Today you're listening to Beyond the Caseload, the Wellness Series, where pediatric specialists come together to help families and providers better understand early development and support children during the years that matter most. Your host is Gabby, Social Media and Engagement Coordinator, and each episode features expert guests dedicated to educating, empowering, and supporting children and the families who care for them.
Hi everyone, and welcome to the very first episode of Beyond the Caseload, the Wellness Series. This series is all about helping families and pediatric providers understand what's typical in development, what falls into that gray area, and when simple guidance can make everyday life easier. So we're starting off with a topic that comes up constantly, and this is the topic of movement. We're seeing kids move less and less, get tired more easily, and choose screens over play, and sometimes just feel unsure about their own bodies. And honestly, a lot of parents feel stuck about what to do about this. Movement isn't just about strength, it affects attention, learning, emotional regulation, confidence, and honestly, really everything. So today we're going to talk about what typical movement looks like, why it matters so much, and how families can support it often without needing that formal therapy session. Today we have a very special guest joining us, and we're joined today by Dr. Abby Sylvestri. She's a pediatric physical therapist here at Progressive Pediatric Therapy, and Abby has a really unique background from working in daycare to coaching college softball to earning her doctorate in PT. All of that really shaped how she connects with her kids and families. She works with children from the ages of infants through school-age kids and is especially passionate about helping families build movement into their everyday lives. Abby, we are so happy to have you here. Thank you for being part of our first Wellness Series episode.
Thank you for having me as a guest today. I'm excited to be able to share something that I'm very passionate about.
And I feel like this is the perfect topic to kick things off. So, you work with kids every single day. What changes are you noticing in how kids move today compared to even a few years ago?
So overall we're seeing this decrease in movement where kids just maybe don't want to move as much or don't have as much opportunity to move, and we're seeing a kind of a shift toward increased screen time. So with that increased screen time, kids are not, being as active.
That makes so much sense, and I think that's a really good way to explain it. What are the most common concerns that parents bring to you, especially around endurance, strength, or confidence?
So I get parents who come in with lots of different questions and concerns for their children, but some of the main ones that I get a lot of parents who come in and say, my child just can't keep up with their peers, whether that's on the playground or at school. I also get a lot of parents who come in saying, my child is really clumsy. They trip a lot, they don't have very good coordination, or they require a lot of rest breaks. So I have had several parents come to me in the past and say, just even when I'm grocery shopping and I have my child with me, we have to stop and take a break every 5 to 10 minutes. So they don't have very good endurance and they can't keep up during those community outings.
So besides seeing these children not be able to keep up anymore, how do you see it also affecting attention, learning, confidence, or even emotional regulation?
Movement affects so many different areas of the body, and movement really helps to make them body connections and strengthen both the motor and the sensory pathways in the brain, which are important for things like impulse control, regulation, mood, attention. So how does movement influence attention? Well, it influences attention to increase arousal and alertness. When a child moves, they get more blood flow to the brain, and so that's going to help increase their attention. It's going to help reduce restlessness. It's going to help reduce brain fatigue and help them be attentive for longer periods of time, and it's going to help improve executive function. Movement impacts learning by enhancing memory formation and recall, and movement really helps to support language between the left side of the brain and the right side of the brain. Movement also impacts a child's confidence. So movement provides really great opportunities for a child to learn how to build mastery of a task, for them to help problem solve. It also helps to improve their body awareness so that they feel more confident in their own body. And lastly, movement also impacts emotional regulation. So it helps to release tension. It helps to support self-regulation, or a child to learn how to kind of calm themselves down. It helps to reduce some of the stress hormones like cortisol and help to release those happy hormones like those endorphins that help kind of regulate and stabilize our mood. So if a child is better regulated, it leads to improved attention, and improved attention leads to mastery. And when a child masters something, they feel a lot more confident in themselves.
And I think that also really leads into understanding what's typical because a lot of families don't know what to compare their child to. So, can you walk us through what typical gross motor development looks like from babies into early school
Of course.
age?
So there are so many different gross motor milestones, and I'm not going to touch on every single one, but I'll kind of hit a few of the major ones for kind of, each age. So from a day that a baby is born, they start to work on lifting their head up, and they become really proficient at this task around 3 to 4 months of age. Around 6 months, their trunk control really develops, and they start to sit by themselves, and they start to roll from their belly to the back and back to belly. Around 7 to 9 months, we start to see a baby be able to get on his knees, rock forward, creep forward. Around 10 to 12 months, a baby starts to pull to stand at a stable surface. They start to cruise or walk along furniture, and they may even start to stand by themselves and take a few independent steps. However, we really see independent walking come around 12 to 15-ish months. Around 2 years of age, we see a child start to jump. We start to see them start to go up and down the steps with a little bit of support. And then around 36 months or 3 years of age, we start to see a child go up and down the steps independently. We start to see a child perform tasks that require some single leg balance or standing on one leg. We start to see a child be really proficient at jumping. So now they're jumping down from elevated surfaces, they're jumping forwards, they're kind of all over the place with jumping in a really good way. Around 48 months or 4 years of age, they're hopping on one foot, their ball skills are really great. So they're kicking a ball, they're throwing a ball, they're catching a ball. And then around those early school age years, or 5 to 6 years old, we start to see children do more complex tasks that take a lot of coordination, strength, and balance, like galloping and skipping.
And I think that's really helpful to hear laid out like that. It puts things into perspective and helps parents kind of just compare it a little better. On the other hand, what are some signs that a child might need more support, even if parents aren't sure if anything is really wrong and they're following all those gross motor development steps and they just can't see if there's anything
Yeah,
wrong?
so there are a lot of different signs that a parent can kind of look out for to kind of clue them into whether that child may need a little bit more support. This is not an exhaustive list, so it's not everything, but a few things. One of the main things would be an inability to keep up with their peers. So whether that is on the playground, at gym class, at school, even in the classroom, that might kind of cue a parent that they should bring a child in for an evaluation or like a movement screening. If a child is really uncoordinated, so they're tripping and falling a lot, they're running into others, they're running into obstacles in their environment. If a child has abnormal movement patterns, so maybe they're only using one side of the body more than the other side, or they're walking on their tiptoes. If a child is not meeting their motor milestones that we just kind of went through, if your child's a little bit behind, that might mean that they need to come in for a screening, as well as a child who maybe just has decreased interest in movement. So they're what I would call, especially when they're younger, a happy sitter. So a child who really only wants to sit and is not interested in crawling or pulling to stand or walking, as well as children who maybe have difficulty with transition. So when you go from one task to another, that results in kind of a big meltdown and you just aren't sure what to do with that, then it may be appropriate to bring them in for either a screening or an evaluation.
That gray area can just be so confusing for families, but also childhood today looks very different than it used to, especially with screens. Have you seen anything based on an increased screen time, if anything has changed in the way kids move, play, and explore?
Yeah, so we're seeing that increased screen time. And so with the increased screen time, kids don't have as much opportunity to play. So I see sometimes kids come in and they're in therapy and we don't have the screen and they're really not sure how to even play. They'll tell me, I'm bored, because they just aren't necessarily sure how to play, how to explore the environment. So overall, we're seeing a decrease, of course, in movement and an increase in screen time, but also I'm always a little surprised that kids don't know how to necessarily play anymore as well.
And I think it's just part of modern life now. Like screen time is so normalized, so I think parents struggle a little bit with
Mhm.
that balance. Are you also seeing any issues with posture, core strength, or endurance because of this increased screen time?
Yeah, so we're starting to see the effects of screen time. So that includes things like a more forward head posture. When they sit, they have these rounded, closed off shoulders. We're seeing weak tummy muscles. And these are things that will only get a little more complicated in the future if we continue to trend toward decreased movement, increased screen time. We could start to see shoulder problems, we could start to see neck problems, even some jaw problems come about, and more likely to arise more in the future.
Definitely. And what about emotionally? How does less movement affect regulation, frustration, or even a child's
So,
self-esteem?
movement is one of the primary ways that a child regulates and calms their nervous system. So, if a child doesn't have the opportunity to move, they're not going to receive enough vestibular and sensory input into the brain, which really can negatively affect a child's ability to stay calm, to manage their frustration, to regulate their mood, and even can affect their attention span.
And I know a huge thing we wanted to focus on in this episode today is a phrase that you say a lot. You often say movement is medicine. So, what do you mean by this? Can you explain to our parents and providers listening what you mean when you say that movement is
Of
medicine for
course.
kids?
So, movement is a therapeutic tool essentially. Movement is not something that just supports physical health, but it also supports brain development. It helps to teach a child how to regulate their emotions, and it helps with overall well being and improving things like self esteem and confidence in children. So, when you think about movement, don't think about it just as something that has physical benefits. It really has whole body benefits, and that's why we say it's medicine because it can positively influence so many different areas of the brain and the body.
I agree, and that's such a powerful way to put it. It really shifts how parents can think about activity and getting that movement in their child's everyday lives. Do you have an example of a child who made meaningful progress just by adding that movement into their daily
Yes, I
life?
do. I have an older kid who is about 14 years old, and one of the ways that he has started to incorporate and his family has started to incorporate more movement into their daily lives is they do the game Just Dance. And so he adores it and it's so fun, but he does this every day and he does it on his own. But since the child has started to incorporate this form of movement, I have seen a total shift in him. He is so much more confident. He is so much more talkative with me. He used to be very, very shy, and now he talks to me all the time and asks lots of questions. He is much more willing to try complex tasks, and he gets way less frustrated if he isn't successful at first. And even the parents have mentioned to me that the school has significantly improved for this child in a multitude of different ways. So that is one of my favorite parts of my job, is getting to be able to help parents and help kids incorporate more movement into their everyday lives and to really get to see the benefits of it and the confidence that this child has gained. It's very rewarding.
That's such a fun idea too, and it's so easy. You could just pull it up on YouTube, and it also incorporates today's day and age of screen time too, but in a better
Exactly. It's
way. For busy families, do you have any other ways for them that they can incorporate building more movement into everyday lives?
So we all have a to-do list that's a mile long, and we're all so limited on our time every day that sometimes even just the smallest changes make the biggest difference. So one of my favorite things that I encourage families to do to incorporate more movement is to open up spaces for play in your home. So really look at the design of your home and try to figure out what's a way that I could change the setup to allow a more open place for my child to climb and explore and to run around. Other realistic ways that families can incorporate movement is to involve your children in daily tasks that you already do every day. So that's things like chores, laundry, dishes. Those are great ways to incorporate not only your children into your everyday activities, but also to increase their movement.
All those ideas seem very doable, and I love that they don't require any extra time, really. So, how can regular routines like these chores, transitions, or time outside become movement opportunities?
That's the great thing about it is even in our normal routines, we can incorporate more movement if we're strategic about it. So normal routines in our everyday life already contain movement, but these routines are a fabulous way to actually amplify the movement and those movement opportunities. So chores, take chores for example. These are tasks that are naturally going to build strength in a child. They're going to build coordination and a child's body awareness. So for example, doing laundry. When a child carries a laundry basket, they are not only building grip and arm strength, but they're building core strength. When a child sweeps and helps to mop, they are creating shoulder stability and improving their bilateral coordination. So all of a sudden, chores become a really great opportunity to involve your child to increase their movement sneakily, meaning that you can kind of do it in a way that they are not really aware of, that you can help increase their strength, their coordination, and their body awareness. Transitions are often a really tough topic because a lot of children will have difficulty transitioning from one task to another because there's this abrupt change in what they were doing. So they want to continue to do the task that they're doing, but you want them to switch. So it's kind of a difficult thing for a child to understand is that they need to go to the next task. So what you can do is instead of just telling the child, okay, time to go, let's go get in the car, maybe like make it a game. So try to do animal walks to the car. Can you walk like a crab or can you hop like a frog to the car so that the child is not as dysregulated? They can regulate their nervous system and it gives them an opportunity to kind of make it more of a playful game for them, which can help keep them regulated and make transitions a little bit easier. And then of course, playtime outside is one of my favorite things. It gives a child an opportunity to play on uneven surfaces, to climb, to dig, to really explore their environment. And there are so many strength opportunities, coordination opportunities, balance opportunities that come just from being outside on those uneven surfaces. So that is a great way, if you can let your children play outside for a little bit, to give them a movement opportunity to help really strengthen so many different areas.
Definitely. And what about for those kids who avoid activity or get tired easily? What simple changes can their parents make in their lives to make it easier for
So
them?
there are so many different strategies that you can start to incorporate that will have a really big impact on a child and the way they move. So if a child has low endurance or they get fatigued very easily, one of the things that I would recommend doing is set really short timers, but do it really frequently. So maybe you start off setting a 1-minute timer to increase movement and then they take a break for a little while. But if you're really consistent as time goes on, you can kind of set that timer for 2 and 3 minutes and then decrease the rest breaks. That's a really great way to start trying to improve a child's endurance. Some other ideas, offering choices. So maybe a child wants a couple different choices so they feel like they have a say in the decision making. And if a child has a say in the decision making, there's a greater chance that they're going to want to participate, especially if they chose the task. The other thing, the last tip I'll give in terms of, what has a big impact on children who tire easily is to change positions. So this is one that I feel like sometimes I don't even think about, is that we need to do things in several different positions. So if a child is standing, they're having to work a lot harder against gravity and they may tire really easily. Whereas if you put the child maybe on their belly on the floor doing the task or sitting down or kneeling, they don't have to work quite as hard and it can actually help to increase their strength and endurance. And then over time, you maybe go to more standing tasks.
I think that leads perfectly into our movement wellness visits. So, for families and even providers new to this, can you just explain what exactly is a movement wellness visit? How is it different from, that traditional physical therapy or medical evaluation?
So a movement wellness is essentially a preventative and a proactive screening. So we are going to assess how a child moves. We're going to assess their posture. We are going to look into what your daily routine as a family looks like. We're going to identify any risk in the child that may lead to future injury. We are going to create a movement plan that is very specific for your child and that you can incorporate into your daily routine. And then we are going to provide a ton of education to you as the parent on how to increase movement, how to increase a child's quality of movement, what are strategies and techniques to incorporate this into your daily routine. And this is different from traditional physical therapy. So in traditional physical therapy, typically the child is already delayed or there is already something wrong that needs to be addressed. Whereas in a movement wellness visit, this is proactive and preventative. So there's not necessarily anything wrong yet, but we want to prevent anything from going wrong in the future. Also, in traditional physical therapy, typically we do a lot of standardized testing. The visits are 2 and 3 times a week for a lot of children, whereas with a movement wellness visit, it's really more play-based. We're looking at how a child typically moves when they're playing, and typically a movement wellness visit is just a couple of sessions, especially when the parent feels like they need it, to really teach the parent how to implement different strategies and techniques at home to help a child move better and to feel more confident in their movement as well.
What families or concerns are the best fit for these wellness visits?
So there's so many different families and children that would benefit from a movement wellness visit. So I'll hit on just a couple of key ones. The first one is children who have coordination or endurance problems. So these are those children who are maybe really clumsy. The movements look very clunky. They have to sit down and take a lot of rest breaks. They can't keep up with their peers in school or on the playground. They would be a great fit for a movement wellness visit, as well as maybe even athletes who are in their off season or have had an injury and are returning to sport. So we can kind of assess how they move and give the athlete and the parent any tips and tricks for, better quality of movement as they go to return to sport. And then the last one are families who are seeking a more active lifestyle or want to incorporate more movement into their daily routine, but they just really aren't sure where to start. We can give tips and strategies to incorporate movement into your routine and simple techniques that can make a big difference in terms of an overall more active lifestyle within the family and the child.
Definitely, and it takes the pressure off actually needing a diagnosis.
Right.
So if there's one thing that you would want families as well as physicians to remember about movement, what would that be?
So movement is how children learn about themselves. It's how children learn about the world around them. It's how they learn about other people. And if you want your child to move more, you have to be very intentional about creating a routine and environment that encourages movement. And overall consistency is the biggest thing. So taking these small changes and just being very, very consistent with them is really important.
And for the last question I have for you today, what is one small change that families could start today after listening to our podcast that makes a huge difference?
So there's so many different things, but I think the first one you should incorporate is trying to model movement to your children more. So incorporating them into these daily tasks like chores, laundry, cooking. Kids want to do what their parents are doing, so if you can incorporate them into things that you're already doing and a little bit more extra time for them, that will make a large change or a big change in a way that the child views movement. And then the other thing is just to start really small, whether it's crab walks to the bedroom or frog jumps to the car or having a kid carry the laundry basket. Those small changes make such a big difference. It's just all about being very, very consistent with them, even if it's just really small to start out with, and then you can gradually kind of work your way up.
Abby, thank you so much for being here. This was such a good and important conversation, and I think it will really help parents a lot. Movement definitely is that foundation for how children learn, regulate, and grow, and even small changes like the ones we talked about today can have a huge impact. So if you're a parent listening and you're wondering about your child's activity level or confidence with movement, a movement wellness visit is such a great place to start. You don't need a referral, there's no pressure, just simple guidance from our therapist. And for providers, these visits are an easy next setup for families in that gray area. So thank you for listening, and we'll see you in the next episode of Beyond the Caseload, the Wellness Series.
Thanks for listening to Beyond the Caseload. If today's episode resonated with you, share it with a colleague or a friend who could use it. And don't forget to follow so you never miss an episode. Until next time, take care of your kids, your caseload, and yourself, because there's always more beyond the caseload.